Did you know that a simple deficiency can completely change how your body works? In today's video, we will unravel the symptoms of vitamin B12 deficiency that you cannot ignore. Stay until the end and find out how to spot the signs before it's too late. Vitamin B12 is essential for several functions of our body, such as the nervous system and the production of healthy blood cells. Although foods such as eggs, chicken, beef, and supplements are great sources of this vitamin, as we age, our bodies have a harder time absorbing it. Statistics show that up to 20% of people over the age of 60 in the United States and the United Kingdom suffer from vitamin B12 deficiency. Unfortunately, this problem is often ignored. But today, let's explore the top 10 symptoms of vitamin B12 deficiency that should never be overlooked. Tingling in the hands and feet. Tingling in the hands and feet, often described as the pins and needles sensation, is one of the first signs that something may be wrong with the nervous system, and vitamin B12 deficiency is one of the possible causes. This vitamin plays a key role in the synthesis of myelin, a substance that surrounds and protects nerve fibers, facilitating the transmission of nerve impulses through the body. When vitamin B12 is at low levels, this protection decreases, causing damage to the peripheral nerves. How does it affect the body? Myelin works like the insulation of an electrical wire, helping in the efficient conduction of nerve signals. Without it, signals can be disrupted or poorly transmitted, resulting in tingling, numbness, or even pain in the limbs. This symptom can be confused with circulation problems or other neurological conditions, such as diabetic neuropathy, but vitamin B12 deficiency is a treatable cause that often goes unnoticed. Who is most at risk? Elderly. As we get older, our body has a harder time absorbing vitamin B12 from food due to reduced gastric acid production. People with specific conditions, diseases such as diabetes, celiac disease, or irritable bowel syndrome, can affect the absorption of the vitamin. Vegans and strict vegetarians. Since vitamin B12 is mainly found in animal foods, these diets can lead to a deficiency if not supplemented properly. Vitamin B12 is not only crucial for functions such as energy, memory, and nervous system health, but also plays a key role in the production of DNA and RNA, the building blocks of life. This connection to cell renewal is what makes its presence essential for healthy skin, hair, and even wound healing. In addition, recent studies indicate that B12 deficiency can have impacts on mood and emotional stability due to its link to the production of serotonin, the famous happiness hormone. This reinforces how a balanced diet rich in foods such as eggs, fish, and lean meats, or supplementation when needed, can improve both physical and mental health. A curiosity is that unlike other vitamins, vitamin B12 is stored in the liver in considerable quantities, which means that deficiency symptoms can take years to appear. This characteristic makes it even more important to maintain regular checkups and attention to subtle signals from the body, such as tiredness or changes in vision. After all, a small change today can prevent big problems in the future. Extreme fatigue. Fatigue caused by vitamin B12 deficiency is not just common tiredness. It is a feeling of intense exhaustion, even after a good night's sleep. This is because vitamin B12 is essential for the production of healthy red blood cells, which are responsible for transporting oxygen to all cells in the body. Without enough oxygen, your tissues and organs cannot function effectively, leading to feelings of general weakness. Why does this happen? Vitamin B12 deficiency reduces the ability of the bone marrow to produce mature, healthy red blood cells. This can result in megaloblastic anemia, a condition in which red blood cells become large, immature, and ineffective at transporting oxygen. Lack of oxygen in the muscles and brain can lead to symptoms such as difficulty concentrating, muscle weakness, frequent dizziness. How to identify if it is vitamin B12? If you get enough sleep, eat regularly, and still feel exhausted, you should consider having a test to assess vitamin B12 levels in your blood. How to treat? Changes in diet. Consume foods rich in vitamin B12, such as red meat, liver, fish, and eggs. Depression. Vitamin B12 deficiency can also affect your mental health. Vitamin is crucial for the production of neurotransmitters such as serotonin, which is responsible for regulating mood. Without adequate levels of B12, brain functions can be compromised, leading to feelings of sadness, hopelessness, and, in severe cases, clinical depression. How does vitamin B12 influence mood? Serotonin production. Low levels of vitamin B12 can reduce the production of this neurotransmitter, often called the happiness hormone. Brain inflammation. Deficiency can increase homocysteine levels in the blood, contributing to inflammations that directly affect the central nervous system. Neurological damage. Over time, a lack of vitamin B12 can lead to more serious cognitive and emotional problems. Who is most vulnerable? Pregnant women. During pregnancy, low levels of vitamin B12 can affect the baby's neurological development, increasing the risk of postpartum depression. Elderly. The decline in the ability to absorb the vitamin can leave them more vulnerable to symptoms of depression and dementia. Treatment and prevention. Balanced diet. Include foods rich in B12 in the daily routine. Replacement therapy. Supplementation can bring significant relief to symptoms of depression in cases related to vitamin deficiency. Psychological support. Combine nutritional treatment with therapy if necessary. Yellowish skin jaundice. One of the visible signs of vitamin B12 deficiency is pale skin with yellowish hues, known as jaundice. This is due to the abnormal breakdown of immature red blood cells, which releases large amounts of bilirubin, a yellow pigment produced by the liver. What causes yellowish skin? Vitamin B12 is essential for the production of healthy red blood cells. When there is deficiency, the body produces larger and more fragile blood cells, megaloblasts, which break down easily. This raises bilirubin levels in the blood, giving the skin and eyes a yellowish tint. What other symptoms accompany jaundice? Extreme pallor, constant weakness, lack of appetite and weight loss. When to seek help? If you notice changes in skin or eye color, see a doctor immediately. Untreated jaundice can be a sign of more serious problems, such as severe anemia or liver disease. How to fix? Proper nutrition. Consume foods rich in B12 regularly. Medical monitoring. In severe cases, treatment with vitamin B12 injections may be needed to reverse symptoms quickly. Inflamed and red tongue glossitis. Glossitis is an often overlooked symptom, but it is one of the most obvious signs of vitamin B12 deficiency. The tongue can become swollen, red, and painful, which can directly affect your ability to eat, speak, and even swallow. Why does this occur? B12 deficiency affects the papillae of the tongue, structures responsible for taste, resulting in atrophy and inflammation. This can cause burning sensation in the tongue, loss of taste in varying degrees, feeling of dryness even with regular fluid intake. How to identify? The tongue may appear smoother than normal due to the loss of the papillae. There may be cracks or sores on the surface of the tongue. Treatment and prevention. Replenish vitamin B12. Supplementation can relieve pain and restore tongue tissue. Oral hygiene. Take care of oral health to avoid secondary infections while treating the main cause. Consult a specialist. A dentist or doctor can help determine the severity of the condition. Cognitive difficulty and memory loss. Vitamin B12 deficiency affects the brain and nervous system, causing cognitive problems such as difficulty concentrating, mental confusion, and even memory loss. Why does this happen? Vitamin B12 plays a vital role in maintaining myelin, a protective layer that surrounds the nerves. When this layer is compromised, nerve connections become slower and less effective. This can lead to frequent forgetfulness, difficulty making decisions, or solving simple problems. Mental confusion, also known as brain fog. Who is most vulnerable? Due to the lower absorption of the vitamin over the years, vegetarians and vegans, for the absence of natural sources of B12 in plant-based diets. Treatment. B12 supplements. Regular doses may improve cognitive function. Brain stimulation. Practice activities such as reading, puzzles, and mind games to keep your brain active. Balanced diet. Include foods rich in B12, such as fish, eggs, and dairy products. Tingling in the hands and feet. Feeling tingling or numbness in the extremities can be an early sign of vitamin B12 deficiency. This symptom occurs due to damage to the peripheral nerves. How does this happen? A lack of B12 causes an increase in homocysteine levels, an amino acid that can be toxic to nerves. This can lead to tingling or pinprick sensations, persistent numbness, especially in the hands and feet, feeling of weakness or difficulty holding objects. When to seek help? If the tingling is accompanied by other symptoms, such as difficulty balancing or muscle weakness, consult a doctor immediately, as these signs may indicate neuropathy. Treatment: B12 replacement. With supplementation, nerve regeneration is possible. Light physical activities promote blood circulation and relieve discomfort. Medical monitoring. In severe cases, B12 injections may be needed to relieve symptoms quickly. Heart palpitations. Vitamin B12 deficiency can cause anemia, which in turn forces the heart to work harder to pump blood and transport enough oxygen to the body's tissues. This can result in noticeable heart palpitations. Why does this occur? With fewer healthy red blood cells, the blood has difficulty carrying oxygen, forcing the heart to increase its beat rate. This can cause tachycardia, accelerated heart rate, feeling of irregular heartbeat, shortness of breath when performing simple activities. How to identify? Feeling of racing heart when climbing stairs or carrying light weights, frequent dizziness or feeling faint. Treatment: correction of anemia. Replenishing B12 levels is essential to improve oxygenation and relieve cardiac stress. Medical consultation. Cardiologists can assess whether there is secondary damage to the heart. Diet rich in iron and B12 improves the overall health of the circulatory system. Difficulty balancing. Vitamin B12 deficiency can cause damage to the nervous system, resulting in difficulty maintaining balance. In more severe cases, it can lead to frequent falls or a feeling of instability when walking. Why does this happen? Vitamin B12 is critical for maintaining sensory nerves, which help the brain process information about body position. Without this vitamin, nerves begin to fail, causing instability when walking, especially on uneven surfaces, frequent dizziness or lightheadedness, muscle weakness, making it difficult to coordinate movement. How to fix? Vitamin B12 replenishment helps regenerate damaged nerves. Physical therapy. Exercise can improve balance and muscle strength. Fall prevention. Make sure your home is free of obstacles and wear non-slip shoes. Respiratory distress. Anemia caused by vitamin B12 deficiency can lead to frequent shortness of breath, even during light activity. This is due to the low ability of the blood to carry oxygen. What causes it? With fewer healthy red blood cells in the blood, the body goes into a state of oxygen deprivation, causing you to feel short of breath. In severe cases, there may be wheezing after walking short distances, feeling of tightness in the chest, dizziness or feeling faint. When to seek help? If breathing difficulty is accompanied by chest pain, mental confusion, or extreme pallor, seek medical attention immediately. Treatment: increase B12 levels. Supplements or injections can quickly reverse symptoms. Breathing exercises, techniques to improve lung capacity can relieve symptoms temporarily. Complete diagnosis. Assess whether other factors, such as heart or lung disease, are contributing to the condition. Vitamin B12, along with other B vitamins, helps regulate homocysteine levels in the blood. Homocysteine is an amino acid that, in excess, can cause damage to the arteries and increase the risk of cardiovascular diseases, such as heart attacks and strokes. B12 plays a crucial role in metabolizing homocysteine, transforming it into other beneficial substances for the body. What many people don't know is that even without experiencing the classic symptoms of B12 deficiency, such as fatigue or tingling, high homocysteine levels can be an early sign that your body isn't getting enough vitamin B12. That is why, in addition to taking care of your diet, it is important to carry out regular examinations to monitor not only B12 levels, but also homocysteine levels, especially if you have a family history of heart disease. Adopting a diet rich in foods such as salmon, tuna, milk, and fortified cereals can make a big difference in protecting your heart and overall health. It's further proof that vitamin B12 goes far beyond energy and the nervous system. It's essential for keeping your heart beating strong and healthy. Thank you for taking the time to learn more about your health. Taking care of your well-being is a valuable investment, and every step you take on that journey makes all the difference. Remember, your body is unique and deserves all the attention. Keep informing yourself, taking care of yourself, and making choices that strengthen your health. We are on this path together. See you next time.